Welcome to #Wednesdays Weekly, a weekly information session in collaboration with the voluntary sector and public sector partners. Today's session is Social Prescribing Offer in Rochdale, and our hosts are Rachel and Bryony. Over to you guys.
Brilliant, thanks Laura. Hello everybody, it's really good to see so many people here. It's like National Social Prescribing Week, so I don't think it could be more fitting. I think my throat's going already as soon as I start talking on a recording. So what I'm going to do today is sorry, have I just been talking for ages on mute? I must have accidentally clicked it off, sorry. So today I'm going to go through a bit of the background of sort of where we fit within social prescribing, how the youth programme came about that we're involved in, and then I'm going to hand over to Bryony as well. We'll have some time for questions in between. Bryony can kind of let you know about everything that's going on at the college, what her role is as the first ever youth worker in Greater Manchester for young people, which is super exciting, if you ask me. And then what I thought would be really good, especially because there's like people on here who I know there's loads of people on here who I've not met before, just to kind of do a bit of exploration around, you know, what's already happening in the area, what do we already know about, you know, what kind of things, you know, are barriers in the way of effective youth social prescribing, but then also what we might be able to do through our wider networks as well, so to support that in Rochdale. It's, you know, quite brand shiny new, so, you know, it's exciting and a bit of a blank canvas to kind of work on, which is really good. When I go into the presentation, I can't always see people or, you know, the chat thing or anything like that. So if people shout out if they need to as we go along, that's absolutely fine. I'll just put comments in there and we can pick it up at the end if need be. First thing I do want to ask though, just to kind of, so that I know where to base things at, is if you could put your hand up if you already know about social prescribing and what it is. Yeah, so a bit of both, a bit of a mixture. So before I go into it then, what I'll do is social prescribing, it's basically any non-medical health intervention. And the idea is that we're trying to establish like a parity of esteem so that medical interventions get the same, well, non-medical interventions get the same kind of priority as what a medical one would. There's a massive national movement towards this through GP surgeries and out in the community. I will touch on the national framework through my presentation, so hopefully that'll give a bit of an overview. And what I've also done in the presentation, I've included loads and loads of links and resources to kind of go into more depth if people would like to do that. A lot of it is stuff that lots of groups are already doing, but they might not be formally linked into social prescribing programs. There's got, I think it's 1,000 link workers were recruited last year to work in surgeries and then to go out into the community and connect people to community-based activities that support health and wellbeing. And there's plans for more and more of those to be rolled out as an ongoing thing. So, you know, it's really good to be involved in that. And, you know, actually it's already, we're seeing that it's having a great benefit for people in Rochdale. So what I'll do, I'll quickly try and share my screen. Hopefully technology will be kind to me. Brilliant. Can people see that? Brilliant. And that's good because I can see a couple of people, so that's fantastic. So for a bit of background, I currently manage several social prescribing projects through Petrus. So that includes Rochdale Social Prescribing Network's funded pilots, which are supported by Greater Manchester Combined Authorities Nature for Health programme and National Academy for Social Prescribing's Thriving Community programmes. Alongside this, we host Bryony, the first youth link worker in Manchester. There's not actually that many across the country either, so, you know, it is kind of really new, this. And that's kind of also linked in with a wider Greater Manchester wide college pilot as well, which I provide project management for in partnership with GMCA. So that's 6 colleges across Manchester. That's supported by the Association of Colleges, Street Games and Curious Minds. And, again, it's like a first where you've had that, connected effort to get young people social prescribing sort of up and running. A lot of social prescribing at the minute is aimed at adults. So what you'll find is if you're trying to, get information, there's not as much out there as there is for the adult population. But hopefully those links at the end might give a bit of a pointer as well, because there's a few things in there that I've included that have got a youth focus. Alongside all that was also PIA, which is our community garden at Petrus, which I know some of you will have heard about and might have visited. And we've also got lots of other health and wellbeing activity that we run as well. So the network itself, Rochdale Social Prescribing Network, it's open to anybody who's interested in social prescribing from whatever angle. So whether it's a service user, VCFSE partner, GPs, link workers, whoever they are, and if they want to get involved, it's there for everybody. Sorry, I've lost my train of thought there. We're kind of using that to share opportunities around training and delivery, share learning. We're using it as a bit of a forum to shape and develop provision and the systems for the borough-wide model. And within that, we've got a number of lead partners. So the partners for the network are Petrus, so that's us, Canalside Primary Care Network, which is where the link workers sit. There are other PCNs as well, KYP, Action Together, and Your Trust and Public Health Rochdale. And we kind of cover like the whole range of interventions really. So we're looking at nature and environment, sports and leisure, arts and culture and finance and advice, and sort of referral systems into those type of activities. We take quite a borough-wide approach in terms of the system. Our kind of long-term aim is that, across Rochdale, Middleton, Harewood, the whole borough, that people can link into services wherever they are that are near to them. But the funded programmes themselves have a bit of a locality-based focus. So they're kind of done through, we've got 3 GP surgeries at the minute where we're actively delivering, and our partner lead hubs at Petrus, KYP and Hollingworth Lake. So we've been kind of through that, we've been expanding provision. We're offering walking, gardening, pottering, it's pottery. Haley's on the call today if anyone's interested in pottery. We've got outdoor arts and nature sessions, we've got 2 climate action programs, and coming soon we've got fishing, a new in-surgery bike library, so people can literally go to the GP surgery and get a bike, which is fantastic. And we've also going to be doing circus skills with Skylight soon as well. So there's several factors that, in my mind, can enable effective social prescribing, which I call the 3 Cs, which are collaboration, co-production and confidence. So collaboration in that surgeries, VCFSE organisations and service users need to work together to create a mutually beneficial system, that system has to be co-produced at all levels, and creating confidence in the sense that we need like a quality framework so that referral partners and service users know that our practice is safe, it's effective and it's evidence-based. And to do that, we're developing training resources to all involved in the network, including volunteers and service users, to support workforce development. We've got a Quality Framework Award, which is supported by Action Together's Quality in Action Award. So I'm sure Laura could give some information about that if you needed it. And that links in, it's kind of marries up with the NHS framework for delivery destinations for social prescribing as well. So it's like really, really effective at kind of getting that that framework in place and that baseline for what we're hoping to achieve for groups that are being referred into. For me, that improves confidence, not just for people referring, but also for service users as well. And we also, through the network, promote activity, and it includes sort of enabling service users to meet with commissioners, GPs, with link workers, everybody kind of on an equal platform, being able to shape that service as well. So we do have a couple of opportunities that I won't mind mentioning that are coming up for free through the network, and that includes introductory courses in permaculture and art, horticultural therapy, and also Connect 5 mental health training as well. So if people are interested in accessing any of those trainings sessions, then just let me know. And there's also, for those who kind of need a little bit more information on what social prescribing is, the GMCA are hosting a really good webinar on the 24th of March as well. So if people would like details of that, I can send that out. And that's just basically a big overview of everything that you could possibly need to know about social prescribing. If you can't make the date, but sign up for the sessions, you can watch it back on a video. So it's, it's really useful, hopefully. So this is kind of like the part of the national model for social prescribing. It's quite a big, document. I have put the link on the slide for anyone who wants to kind of look into it in more detail. But some of the key aims of the framework are to increase an understanding of what good social prescribing looks like and why it improves outcomes and experiences for people, to support commissioning of local social prescribing schemes, enabling all general practices and local authorities and agencies to refer people with wider social needs to community-based support, and to encourage collaboration, working amongst all local partners at a place-based level. So the idea is that we're going to recognise the value of community groups and assets to enable people to build relationships, connections, and a sense of belonging, which, we all know in Rochdale what a valuable contribution the voluntary sector kind of provide around that. So these are the links that I've mentioned on the end of the slide. And one thing I've noticed, which I mentioned earlier, there's not as much there for youth social prescribing, but within those links, there's absolutely loads of stuff on the National Academy for Social Prescribing website. There's a little video there, what is social prescribing? It's literally like 3 minutes long, and it's really, really good for sharing with people to kind of highlight what it's all about. I've included the sort of strategy around children and young people's health for Greater Manchester, which social prescribing links in heavily with. NHS England have recently developed a children and young people platform, which it's worth noting they're looking at building like a resource pack at the minute, which is something that we're involved in through the network and at Petrus, sort of putting some of them resources into that as to what's already being used, so people can, if you want to get into social prescribing, you can literally pick up an example template of a referral form, or it might be, say the Quality in Action Award, looking at that and going, these are the things that we want to kind of make sure that we've got in place. So hopefully, I think that provides a bit of an overview, I hope. I know there's probably a lot there. I thought, given it Social Prescribing Week, it'd be nice to end on a little quote from one of our service users who says, "Thank you for helping fill a gap in my life. Being in nature is true therapy," which I completely agree with. I'm not biased at all. And then also there's another sneaky one in the back there, which is from one of our volunteers, Les, who likes to tell us that if you try, you can make anything happen, which I think that applies to everybody. So that's me. And then if I come out of this, if I can. There we go. So has anyone got any questions so far? Are you ready?
Okay, hi everyone.
Well,
so thanks for that, Rachel. I think you gave a really nice overview of social prescribing and what's already going on in Rochdale. So I'll just give everybody a little bit of an update of what that specifically looks like in the college. And a few of you are asking questions, and me and Rachel are just finding out how this is working in terms of young people. And if anyone's got any advice or things that you think that we're missing, please feel free to reach out, send one of us an email. I'm sure there is things that we're missing, but this is just a social prescribing pilot, so we're seeing how it works, and we'll be looking at what kind of things we can learn from and do a bit differently. So to give you a bit of an overview, there's obviously targets for me to meet within the 12 months of this pilot scheme, the 12 months. and the goal was 100 contacts with young people, and I'm currently at 150. So that's starting just before Christmas, but it was kind of like inductions and things like that before Christmas. So it's basically the first half term starting in January. So 150 contacts, and of that, we've had 61 referrals and 89 group contacts. So that's people who've come to the groups that I've put on, which I'll come to in a minute. So the 61 referrals that have been made to me, they've come from the pastoral support staff within college. And I'm usually getting referrals for people who it's high anxiety. They're usually people who are being referred to counselling at the same time, the college counsellor. They've probably had previous involvement with CAMS or other mental health services. And when I speak to the young people, a common theme and problem is a real frustration with the mental health services that they've had. You know, a lot of the young people that I'm working with, 16 to 18 is the average kind of age that I'm working with. And they've had a really long involvement with mental health services that hasn't been great. So it's nice to be able to offer them something different to try, and to say, yeah, I understand, you know, the medication side of it, and going to the doctors is incredibly important, and you know, I'm still encouraging them to do that, but here's what we can do while you're waiting, and to support you whilst you're going through that. So I mentioned that I've started a couple of groups since I've been at college, which are going really well. So I've started an LGBTQ+ group at each campus. We're awaiting a name for the group. I'm going to be putting that to the students this week to get them to come up with something a little bit with a bit more personality to it. So that's going on at the moment. I've also got a Good Vibes group, that was a name that I came up with, which is a bit of a mental wellbeing group, which I'm doing that at both campuses. So obviously I'm based from the Middleton campus and the Rochdale campus, so I'm trying to split my time as evenly as I can between the two. So in that Good Vibes group, we're doing things like positive affirmations, a little bit of mindfulness. Sometimes they just come and sit and eat the dinner in there, and it's just like a safe space for them to come and meet new friends. I've also taken over the ESOL group, which for those of you who don't know is English for speakers of other languages. So we've got quite a big ESOL group at the Rochdale campus, and I've started like a friendship group. It's a bit of a lunchtime club that I've been running there, and I found that those groups are really good. So that once I'm having these referrals from the staff, and I'll have an initial conversation with the young person, and it's quite good to have these groups to be able to signpost to in college. And for some of the young people, they are just so nervous, and the only thing that they are doing is going to college. So it's really nice to be able to, it's kind of like a bit of a hand-holding process, and working up from that. Sometimes I'm having to work them up to come into the group, so it's just them coming to speak to me for a bit, then, you know, they'll have a regular contact with me, then we'll say, right, let's try the groups. They'll come to the groups in college, and then I'll meet with them again, and it's like about then signposting into the external agencies, which is, you know, I've been signposting into the youth service, into Vibe Creativity in Rochdale, the Proud Trust, the LGBT Foundation, you know, depending on whatever it is that their needs are. And obviously meeting with people like yourselves is really important to be able to find out what I can signpost to. So Rachel had mentioned before that I have done a lot of work trying to figure out what is going on. And from my previous experience, I was aware of you know, some of the different provisions within Rochdale for young people. But I have noticed that there is a lack in provision for 16 to 18. A lot of the cut-offs are, you know, they stop at 16 and then they start again at 18. And I know that there's a lot of issues with insurance and funding and things like that. But it has been a bit of a struggle when I've been looking for specific things, trying to find things for that kind of age group. So that's kind of like where I'm up to, what I've been doing. And I'll just give you a little bit of an insight into what my plans are for the next couple of months into pilot scheme, which is really exciting. So I've already met with a few of the different agencies, a few of you who are on today. So it's nice to see you all here today. So I've got some plans to be working with your trust and putting on some activities to work together to bridge that gap and meet the needs of these young people. There is a want to get physically active from the young people, but I'm finding that this lack of confidence is massive, and I want to be able to support them into getting active and getting social in the best way that I can, without just saying like, here you go there, because I know that they won't access it. It's not as simple as just letting them know what's on. It's got to be like a supportive process. We've also got plans to commission different kinds of activities. So Voice Assembly, it's nice to see you again. I'm sure that you're a bit bored of listening to me, to be honest, after listening to me last week. But it's nice to see you. So we're planning to do a little bit of work within the college, maybe starting a youth choir, get some activities booked in with them, and also looking at doing some specific work with different groups within the college. So I've had a few different tutors, different people within college coming up to me asking, I'd love for you to work with this group, I'd love for you to work with this group. So Skills for Life, which is a provider of disability training within college, they've come up to me, and there's a class that are really struggling to concentrate. So they've said, we'd love if you could come and do like a little bit of a mindfulness class with the students. So I've booked in a few weeks of doing that. And then that will hopefully lead to social prescribing with them and signposting into external support groups outside of college. I've been asked to work with to do like behavioural support for groups of students who are struggling with like behaviour, motivation, and the idea is to just give them a little bit of a taste of something in the outside world, keep them motivated in college. Yeah, I don't want to bore you to going too much into the specifics, but yeah, there's a few different groups that we're looking to do specific work within college. But I have found that my groups have been really helpful, and then looking forward to the commissioning that I'm going to be doing, it's probably going to be focusing on those specific groups, because then it'll be easier to reach out, and obviously then it will be open to work to anyone who wants to come and join in. But yeah, that's kind of how we're rolling at the college at the moment. It's been difficult finding my feet, but it's been really good, and Rachel's been really good. So thanks, Rachel. Yeah. Okay. Has anybody got any questions for me?